All right, it's 11 a.m. Hey, everyone. Thank you all for attending today's discussion on the equitable design practices for healthcare teams. We're going to give people a few more minutes to join as we do. But today's presentation will be on impacting health equity with diversity, equity, and inclusion principles. We're going to leave about 10 minutes at the end for questions from the chat, but it is also all right if you have a burning question to unmute and we can address it. Today's speaker is Dr. Félix Manuel Chinea. He's a medical doctor by training, and he's now with Doximity. And in that role, he is the Diversity, Equity, Inclusion, and Belonging Manager. He's an expert in his fields, and he leans into data-driven approaches to critically evaluate the systems that we use to ensure equity for individuals in the digital health space.
All right. Thank you so much, Jeff. Yeah, I'm excited to talk with you all. My name is Félix Manuel Chinea. As Jeff said, I'm the Diversity, Equity, Inclusion, and Belonging Manager at Doximity. My pronouns are he, him, el, depending on the language that you're speaking. And I'm here to talk to you about advancing digital health equity. All right, so what are we going to talk about specifically? So this presentation is meant for us to discuss the concept of utilizing diversity, equity, and inclusion principles to build diverse teams and foster an inclusive culture that allows us to build the equitable design, product design in pursuit of health equity. So ultimately, we're trying to move from DEI in theory to DEI in practice. Okay, so how are we going to do that? How are we going to make that transition from theory to practice? Well, we're going to speak about it in 4 components. We're going to talk a bit about health tech disparities. We're going to learn from others' mistakes, how inequitable tech has actually impacted patients. And then we're going to dive into DEI principles and how DEI can impact health equity. And then lastly, we'll focus mostly on equitable product design and how we can center equity in the design process. So first, before we start, I want to ask a question to you all. I'm curious to know what 3 words come to mind when you think about the impact of technology on health. And to answer this question, please go to menti.com. You can go on your phone or your computer and then enter in this code that shows there. And you can enter in 3 words that come to mind when you think about the impact of technology on health. And we can see those results or those words come in real time and see what you all think. Very curious to know what is the perspective of the audience. And if you missed out on the information, you could look at the top of the slide here. It's menti.com and then the code above. Don't feel any pressure to have the best words. I'm curious to know what's the first words that kind of come to mind to you. All right, so we've got 5 results in. 5 people have responded. I like it. We're seeing things like lower cost, healthier, accessible, faster, precision, even too much information. That's valid. We can see lower costs kind of being centered here. Few people thinking that it definitely lowers cost. Definitely seeing faster come out, better. Easy access. It can be clunky at times. Awesome. Well, I appreciate you kind of going through that exercise. Definitely curious to know what you all think, especially coming from a health tech perspective. It's interesting to see what is our own perspectives on the potential for technology to impact health, and what are we looking to get out of it, and what do we think technology should do in serving patients to impact health. So let's move forward and talk a little bit about health tech disparities. How does tech impact health disparities? Before we start, so here's a quote from the American Medical Association, the Center for Health Equity, where they say, "Getting to equity and justice necessitates a sense of urgency and ambition." I think this is really important as we begin this conversation, because in order for us to impact health equity and health justice, what we need to have is really a sense of urgency and centering in equity as we make that approach, and also having ambitious goals. I think it's important for us to not temper what we're trying to achieve here, and really be ambitious about what we're trying to accomplish with the solutions that we create. All right, so health tech disparities come in two parts. Well, first, health disparities, which is a type of health difference that is closely linked with social, economic, and/or environmental disadvantage. And then there are tech disparities, where researchers have designated internet connectivity and digital literacies as the super social determinants of health. So what does the impact of health disparities look like? It comes in two parts, mainly health access and health outcomes. Health access can look like, the fact that 53% of LGBTQ plus patients delayed or avoided medical care, compared to 41% non-LGBTQ patients after the pandemic. So I think it's important to look at this fact and understand that health access is not equal across communities. So it's important for us to have that understanding in that context as we're developing solutions and as we're creating products. And health outcomes can be the fact that about 3 years of life expectancy was lost from Black and Latinx Americans from 2019 to 2020. So again, this is a statistic around pandemic times, and really points to the fact that existing health disparities in those communities were actually widened, made worse during the pandemic. So I think what that really touches on is the fact that the existence of health inequities within our healthcare system actually weakens the system as a whole. So whenever there's, say for instance, a viral pandemic that happens across our country and it impacts everyone, it actually impacts certain communities, those most vulnerable, worse. And I think it's important to keep that in mind as we think about healthcare as a system and what inequities are actually telling us. It's telling us that we have a weakened system across the board. And what does the impact of technology disparities look like? Well, I think it's important to think about this in three different parts: connectivity, affordability, and accessibility. So under connectivity, for instance, 15 to 24% of Americans lack broadband connection. Under affordability, 24 to 25% less Black and Latinx individuals own a desktop or laptop computer. And under accessibility, 27% of adults 65 and older do not use the internet. So again, I think these are really important facts and statistics to keep in mind, because it gives us context of what communities across the US are going through, what is their lived reality, because without understanding that, we can't really develop solutions that answer the questions that are most relevant to those communities and impacts them in the ways that are most relevant to them. All right, so now we've learned a little bit about what the disparities look like. What are past mistakes that others have made at which we can learn from and we can do a little bit better? How has inequitable tech actually impacted patients? So to start off with another quote, Rhea Boyd, a pediatrician and public health advocate, says, "The solution to racial health inequities is to address racism and its attendant harms and erect a new healthcare infrastructure that no longer profits from the persistence of inequitable disease." So I think this is a really important quote it really gets at the fact that to address racial health inequities, we really have to understand racism and understand its impact on healthcare and the health outcomes of those communities that racism involves or impacts. What that really gets at is the relevance of social and historical context across communities in order to improve their health. We need to have those understandings when developing technology, science or technology solutions to be able to impact those communities in a meaningful way and be thoughtful about the process in terms of choosing the right questions and creating the right solutions to answer those questions. So what does racial bias look like in technology and how has it impacted patients? Well, to start off, lack of data representation affects artificial intelligence performance. More specifically, lighter skin tones vastly outnumber darker skin tones in widely used dermatology atlases, which led to disparities in AI models' ability to diagnose skin conditions in darker skin. Non-diverse cohorts affect the accuracy of vital medical devices. More specifically, Black patients had nearly 3 times the frequency of occult hypoxemia that was not detected by pulse oximetry as compared to white patients. Something that's extremely relevant during a pandemic in which we definitely need accurate measurements of blood oxygen levels across patient populations, and to know that Black and Latinx populations are affected more heavily by the pandemic, and we're dependent on medical devices that may be biased against them in terms of giving us accurate readings. And lastly, racial ignorance is harmful. So 1 million Black adults might be treated earlier for kidney disease if a race-based correction factor was removed from a widely used kidney function calculation. And this is specifically the estimated glomerular filtration rate calculation that's used to determine what kidney function is like for patients. I think this is a really important finding that happened, where if we remove this race-based correction factor, patients would be diagnosed earlier in kidney disease, which means they would be treated faster. We would avoid late-stage disease more often. And not only that, but there would be more Black patients eligible for transplantation, which would save lives. I think the important thing to note about this is that this stems from the misunderstanding of thinking that race is an actual biological factor, thinking that kidney function differs across racial groups, which is completely wrong. Race is a socially created term. There is no difference in biological function across human beings depending on race. All right, so we've learned a bit about disparities, about past mistakes that have been made that we can learn from, and where do we go from here? I think a great place to start is from diversity, equity, and inclusion principles. And we're going to talk a little bit about how diversity, equity, and inclusion can actually impact health equity. All right, so another quote, Stephanie Creary from Wharton School of Business says, "To meaningfully prioritize diversity, equity, and inclusion in the workplace is not only the right thing to do, it is a business imperative." I think this is really important to reflect on. What this is getting at is that not only DEI is the moral thing to do, but is also relevant and important for the business. And I think understanding DEI as a lens for all business functions really helps us understand the relevancy for all of us. And on that note, I want to ask you all another question. So I am curious to know, how relevant do you think diversity, equity, and inclusion is to your work? So the work you do every day. And you should go to the same website, menti.com, and use the same code below, and we can see everyone's answers populate to that question. And I'm asking you to rank this on a scale from 1 to 5, 1 being not relevant and 5 being very relevant. So I'm curious to see what everyone thinks. And again, there's no wrong answer to this. I think everyone's at a different place in their journey. So it's just interesting to see if everyone sees that connection yet or sees things a bit differently?
Hey, Dr. Chinea, this is Keith Dupre. How are you? I just
Good.
went to try to post my answer, and just as Susie is saying, that particular function isn't working for us to submit.
Okay, let's see if we can.
Can you also please post the code so that we can see that once again?
Yes.
Thank
The
you.
code is 3758-2715. And let me know if you're able to get to that question. We'll give it a couple minutes, and if not, we can move on. That's fine.
Hey, Dr. Chinea. Yeah, it's there, but there is no 1 to 5. It's just a submit button. Or
Okay.
there's no relevant, not relevant.
Okay, that sounds good. We can move on then. All right, so I think the important thing to talk about that I had expected kind of from everyone's responses, I'll infer my own kind of biases in terms of what I would think most audiences would say, is that there would be a mixture of folks who see the relevance to their work and those who may not, and who may see the relevance to their work. I think the important thing moving on from here is to realize that DEI can be a lens to all work that's done within organizations. And I'm hoping to communicate that with you all throughout this presentation. All right, so we've been talking about diversity, equity, inclusion in one single sentence. I think a lot of times you hear them mentioned in a singular breath. I think it's important to take a step back and talk about that there's 3 individual components here, and they each have their own definitions. There's diversity, equity, and inclusion. And it really takes all 3 components in unison to get at that sense of belonging or that culture of belonging that we're looking for. So what happens when you have a diverse organization, for instance, an inclusive culture without equity? Well, you get a culture in which the dominant group or ideology is deferred to for decision-making, opportunities, and promotions. And what happens when you combine diversity or a diverse organization with equity? Well, you get a culture of assimilation that results in disengagement and low retention. And what's really happening here is equity is getting at a sense of being able to capture the diverse organization and put them in positions of power and decision-making capabilities. So without an inclusive culture, you're putting them in an environment or a culture in which they are pressured to assimilate, and they're not able to take their lived experiences and have that translate into the decision-making and the products that they create. And without equity, you have a culture in which you're bringing folks from a diverse backgrounds in an inclusive culture that sees them for who they are and values their lived experiences, but you're not putting them in positions of power throughout the organization and positions of leadership where they're able to actually influence the business and influence the products that is created. And as this quote says up to the top left, increasing demographic diversity does not by itself increase effectiveness. We really need all 3 components to come together to get at that culture of belonging, where you have an organization that engages full potential of the individual, where innovation thrives and views, beliefs, and values are integrated. All right, so we talked about the 3 components and what are the principles of DEI and how is this relevant to health outcomes and how do we impact patients from there? I think DEI and what it can do for organizations and ourselves as individuals is the fact, starting at the point of where we understand that race is a social construct. So race is a social construct, which sometimes can be met with or followed up with, well, if humans created race and it's socially created, why do we use it? It has no biological grounding or scientific grounding. But I think what DEI helps us do is take it that step further and understand that historically race has been used to oppress communities, and this has had generational impact over time. And that is super relevant when it comes to health outcomes, because as that generational impact is built, that's where we get to a society that has embedded systemic racism across different industries and across different functions. And this has an impact on health outcomes, so much so that racism has been named as a social determinant of health and a public health crisis by multiple healthcare organizations and medical organizations as well. And I think taking in these DEI principles, moving from understanding what race is and having that better understanding the impact of systemic racism on health outcomes, we move into combining that with some of the past experiences or past mistakes that we just talked about, and understanding that products reflect the biases of their creators. We know now that technology is not immune to bias, and it can impact health outcomes. And in fact, technology just amplifies the bias of their creators. So it's important for us to keep this in mind when approaching solutions, approaching products, and creating diverse teams to be able to impact those spaces. And then how do we move from here? I think it's about improving our racial consciousness. And again, DEI those principles help us improve that. It's about going into this space and being curious about racial equity through attending trainings and doing our own self-education as well. What this ultimately does is helps us put that historical and social context of the lived experiences across communities and implement that into the solutions we create, so we can actually bridge the divide of health disparities and really impact health equity in a meaningful way. All right, so we've talked about health tech disparities. We've talked about past mistakes that we can learn from, and we walk through diversity, equity, and inclusion principles and how they're relevant to health outcomes. So how do we take it that step further and really embed it into what we do as health tech professionals? Well, it's about equitable product design and how we functionally center equity in design. And giving you another quote, Una Kim, co-founder and CEO of Arene, says, "Our diverse team is critical to product design to ensure those we touch are served in a personalized way. Representation in-house impacts everything from scripting to product design to outreach." I think this is really important as we move into what equitable product design looks like, because it helps us understand that diverse teams are very important when it comes to the design process, when it comes to creating solutions that impact the communities that those diverse teams come from. And I think it's important for us to understand and transfer the lived experiences of diverse teams into products. And that means valuing lived experiences as much as we value work experience or education, and really understanding that that benefits the business, it benefits teams in creating relevant solutions and asking relevant questions. So where do we start? Equitable product design for digital health. I think this is a great framework for us to begin the work and really kind of anchor the conversation around how to create equitable products in the digital health space. This is adapted from a report that comes from Rock Health, specifically Building Toward Equity, a working model for digital health. I recommend reading the report. It's very great and very well written. We start off here with centering in the community, working from within the community for which you're designing and not working for. Then we're going to move into co-designing the solution, where we gather a diverse team from and/or with connections to the community to design the solution. And then we want to develop the right tech. That means developing technology that does not include or perpetuate bias. And lastly, we want to make it accessible, where we ensure the solutions are discoverable, accessible, and usable. So how do we center in the community? Well, first, it begins with building trust. We want to make sure that we build trust with communities by recognizing historical context, investing in long-term relationships, and recognizing disparities are a collective solution. Require a collective solution. So we want to make sure that we're approaching these disparities and approaching inequities from a collective solution approach, not an individualistic perspective. We can't solve these things for communities. We have to solve with them. And I think that's really important to recognize as we kind of begin this framework process. And a great approach to be able to do that is a community-based participatory research approach. And some of the benefits that come from such an approach is that it helps us select relevant research questions, helps us develop culturally appropriate metrics, and helps us improve our understanding of a community's unique circumstances as well. And then we want to co-design the solution. So what does that look like? Well, it looks like representation, equity, and inclusion. So representation impacts product design and everyday decisions. I think we're trying to drive home this point that diverse teams are very important. And it also means that we have to value lived experiences of those diverse teams as much as we value work experience and education, because that influences everyday decisions and it influences product design, which ultimately impacts the communities we're looking to serve. And then next, to design for equity, we must design equitably. Ultimately, process is product. So if we want to create an equitable product, that means we need to have an equitable process in creating such a product. I think this is a really important point to make, because having diverse teams is a start, but we need to have an equitable process that bakes into the process self-reflection, historical context, social context, so that we can create equity in the process and then ultimately let that reach into our products and solutions. And then inclusion is not the lack of exclusion. So what this is really getting at is to create an inclusive culture is not only about stopping systems, processes, and practices from excluding others. It's about creating a radically inclusive culture that sees people for their lived experiences and values them, and has them create that sense of belonging within organizations so that they feel that they can actually influence the direction of the company, so that ultimately the organization can benefit from that as well. And ultimately patients can benefit from that, from those solutions and those products that are created down the road. And then we want to develop the right tech. So diverse teams and representative research definitely helps reduce bias, but ongoing data collection and testing processes are absolutely needed. First, that looks like intentionally collecting data. So we definitely want to start by collecting relevant race, ethnicity, and language information, but I think this is just a start. I think what we really need to be doing is reflecting on the types of solutions we're looking for, what communities we're trying to impact, have that historical and social context influencing the questions we choose and that we're trying to answer, and then ask ourselves, what data do we need to be able to answer those questions and really get at the solutions we're trying to build to impact those communities. Next, we want to continue building trust with those communities. And what does that look like? That looks like clearly sharing the context about the data being collected with those communities and addressing any concerns that the community might have. And lastly, we want to consistently check for bias. So we want to create a system of checks and balances from design to post-launch to constantly assess the product during its process of being built and ask ourselves what biases are currently in there, how do we make it better, how do we root out those biases, and creating a growth mindset of developing these products, because we want to understand that unconscious bias is going to always exist. We're going to have a better understanding of what that looks like and what biases might be in these products over time. And as that happens, we want to constantly iterate on products to make them better and better serve communities. And lastly, we want to make it accessible. So I think it's really important start, or a good start for us to think of accessibility in these 5 components. We want to start off with language, making sure that content is translated appropriately and that language services are available when appropriate as well. We want to keep in mind health literacy, making sure we adjust reading level and font size to be able to better serve our communities that are using these products. We want to keep in mind digital literacy, making sure that we provide customer support to help navigate solutions. And then keep in mind accessibility as well by adhering to ADA guidelines and adapting the products for patients with disabilities. And lastly, we want to keep in mind devices. So we want to make sure that we're doing mobile first solutions. As we learned earlier, not everybody has a computer or laptop. And then also making sure that we're supporting older devices. So not everybody is able to afford that latest iPhone or Android device. So taking a step back, we just walked through this framework of equitable product design for digital health. Again, I think this is a really good framework for organizations and teams to start from in building equitable products by centering in the community, making sure that we're working with the community, co-designing the solution by having diverse teams, investing in that recruitment process and making sure it's impacting teams across the board and creating cultures and where folks feel included enough to help drive the direction of the products, developing the right tech by creating systems of checks and balances to root out biases that exist in products and constantly iterating on improving as well to better impact communities and being open to feedback from communities to help navigate and identify those biases, and then making it accessible. So ensuring that we constantly improve the accessibility of our products and starting off with those 5 components that I shared with you, but also being open to increasing accessibility outside of those 5 components as we learn more and have a growth mindset when approaching equity within our products and services. All right, so as we kind of finish off talking about this framework and how to center equity in the product design process, I want to leave you all with some words of encouragement and guidance from some health tech leaders and some leaders in the health equity space. Yeah, so let's get into it. I think it's great and important to reflect on some of the words of some of these thought leaders. So Dr. Ivor Horn, Director of Health Equity and Product Inclusion at Google, says, in digital health, it's critical to lift up founders and teams who have lived experience and context around the products being developed. Digital health is more than the code. It involves connecting lived experience to what you're building. So again, it really hits at this theme that we've been talking about today of really valuing the lived experiences of diverse teams and having that translate into product. And the onus is really on the organization and for people leading teams to create that culture in which folks feel like they can actually help navigate that experience. So as much as work experience and as much as education influences the work you do and how you decide on which products to create and how to create them, lived experience is equally as relevant and helps provide that historical and social context through the design process to be able to impact communities in an equitable and thoughtful way. All right, so KP Yopala, the CEO of Inon Health, says, without intentionality, we're going to see an increase of the digital divide. So many people, particularly the most vulnerable, are not in a place to utilize the tools for telehealth and other virtual care services. So I think this is really getting at what we talked about earlier of both the health and tech disparities and talking about how we really need to be intentional about our approach and our solutions that we develop. Otherwise, we're going to increase that divide. And what that really gets at is without intentionality or without adding in the historical and social context into our solutions and our process, we're not really going to be able to develop intentional solutions. And those realities exist in in communities across the US, whether we like to admit or understand them or not. So understanding them really helps us develop solutions that are going to impact them in a meaningful way. And lastly, Aaron Bali, CEO of Carbon Health, says, design is one of the main things that creates trust between people and their providers. All health innovators should be design obsessed. And I think this quote is really great. I think it gets at the impact of the design process and how impactful design is on creating the products or solutions that come out of healthcare organizations. As I said before, process is product. I would take this one step further. I would say that we should all be design obsessed with equity at its center, because unless we center equity in that design process, we're not going to create equitable products. But yeah, I think it's really important to to hear this, to reflect on this quote and think about how impactful the things we create are across communities, and especially for their health. All right, so that's all for this talk. I want to thank Blue Cross Blue Shield of North Carolina for inviting me to the Tech Summit. I'm very appreciative of being in this space and talking about equitable product design in the digital health space. I'm very passionate about this. Thank you for you all for being so engaged. Apologies for the technology glitch on the second question. And yeah, if you want to reach me outside of this presentation, here's my information. The QR code takes you to my email. Feel free to email me or reach out or just connect. And if there's any questions from the chat, Jeff will actually moderate those questions and ask me them, and I'll try to answer them as best as I possibly can.
Yep. Thank you, Dr. Chinea. And if you would also like to ask directly, feel free to unmute. All right, Keith has asked, how long does it typically take for a company or team to recenter on equity in design?
Yeah, that's a great question. I think when it comes to diversity, equity, and inclusion, the quick answer is that there's no fast and quick answer. I think as we discussed, this, like, the framework really encompasses a lot of parts and pieces and teams that are involved in that design process. Obviously, like, being able to implement such a framework requires a lot of leadership buy-in and a lot of top-down support to be able to do such a thing. It's really hard to be able to do that from a singular team perspective. So to answer your question more specifically, I think it takes years. I think you can always do your best in centering equity in your individual decision-making and your specific team's process. And that can have an impact, a more immediate impact within what you create. But to have a larger impact across organizations, I think that's definitely a larger lift, but definitely worth doing. It just takes a bit longer to implement.
Awesome. I have a question. As far as you're a North Carolina, well, not native, but you've been around for quite a while. Within North Carolina, what communities have you interacted with to get the lived experiences and to get this sort of DEI insight?
Yeah, no, that's a great question, and definitely appreciate that coming from Blue Cross Blue Shield of North Carolina, looking to see what specifically is at North Carolina. And that's a great framework of being able to ask yourself the question of, like, not only what are the demographics and communities across the US, but who are we trying to serve specifically? So within North Carolina, it's definitely relevant to talk about underrepresented communities in tech. That's specifically Black and Latinx communities. The Latinx community within North Carolina is very fast growing. So I think it's very relevant to talk about those communities and ask the question if they're adequately represented across teams within the organization, and to really translate those lived experiences in there. I know we have, Native American or Indigenous communities within North Carolina as well that are underrepresented in technology and underrepresented across many industries. It's important for us to ask the questions of how we're trying to impact those communities. What is the social and historical context in which those communities have been impacted in North Carolina and by past health organizations? Because those always influence the trust building and the communications that you have with them, and trying to develop that long-term relationship. So it's important to come into these conversations of community trust building with that understanding that there may be hesitancy because there is a context in which you're starting this conversation. Just because someone may be coming into this conversation new and fresh doesn't mean the conversation didn't begin a long time ago. Awesome.
All right, so we have a few more questions in the chat. Yvonne has asked, is there a comprehensive list of the data points, as in demographics, genetics, and things like this, that are included in the framework? And If so, is there a location that we can view that?
Yeah, that's a great question. I think there's two parts to answer that question. I think there are basic data points that we can start from. Some of them I listed there, the race, ethnicity, language, and so forth, that you can start from. Reports like the one that I mentioned from Rock Health can be a great place to start. It's heavily cited and really gives credit towards other people's work and research and many years of experience that led to creating the framework. I think those are great places to start and really lean on the research and data out there of like health equity leaders that they've worked on. The second part, that's the answer to that question, is that that's only a start. I think depending on the solution and the answer or the question that you're trying to answer is, determines what kind of data points that you want to create or the data points that you want to collect. I think if you're trying to impact the LGBTQ plus community, if you're trying to improve health equity within that space in North Carolina, I think you need to ask the question about, you know, what has this community been through historically, and in current times, what's the social context for them in North Carolina? How does that impact their health? I know these can be very philosophical questions, and coming from a STEM background or like science and technology background, you're looking for something very tangible and direct. But I think it's important for us to ask these questions because they're not always fully answered, and they're not always the same answer depending on the question that we're trying to solve. Hope that makes sense. And feel free to ask a follow-up if it didn't quite make sense.
No, it makes sense. Thank you.
Great. And then we have a question from Liz Klein. She asks, use lived experience and historical context in terms of gathering verbal contributions from representatives of various communities within an active design process. What do you think about building a compendium of this knowledge in an externally shared repository?
I'm curious to hear a little bit more of what that looks like, if you don't mind adding a bit more color to it, to the question.
Liz, the way I understand this, with the lived experiences, having maybe a repository of audio clips or stories of individuals and their experiences within this, so that people, organizations can look to it as a source of data for when they want to initiate their DEI.
Okay. Yeah, that's a great question. It's an interesting idea. I think the one hesitation that I would have about that is really clearly communicating the context at which that data was collected. You want to be able to, if you're going to have some sort of repository that exists like that for other organizations to look into and gather insight about communities, you want to clearly communicate, you know, what does the representation of those communities look like? Even if it's a singular community, you want to be able to communicate, you know, what generations are reflected within that particular cohort that you collected that data from, what questions were asked. Again, this kind of gets at this philosophical notion of taking a step back and asking, like, you know, what potential biases are here, who was asking the questions, what was the context for that community in this particular moment in time, like what was going on for the community, politically, historically, what's the social context for them in North Carolina at the time. It's hard to communicate that in a data repository in a meaningful way that's going to avoid other organizations jumping in with particular questions that they're trying to answer, looking at the data and just kind of overlaying the answers to answer the question that they have without them asking those tough questions and asking themselves, does the context at which the data was collected actually match the question I'm trying to answer?
That's a great point. Yeah, it's context is key.
I'm a
For
huge contextual data nerd. That's what I like to describe myself sometimes.
All right, if there's any other questions, I think we may be at time. And with that, I would like to thank Dr. Chinea for that awesome presentation, and for all of you for choosing to attend Equitable Design Practices for Healthcare Teams. Now, if you wouldn't mind going back to the live stream of day 2 on the Tech Summit website, we will close out our virtual conference experience with a quick Tech Talks presentation and final announcement. Enjoy the rest of the Tech Summit. Thanks.
Awesome. Thanks, everyone. Have a good day.